Question 1. Which of the following is the generic name for the brand name medication Lipitor? A. Atorvastatin. B. Simvastatin. C. Rosuvastatin. D. Pravastatin. Answer: A. Atorvastatin. Atorvastatin is the generic name for the brand name drug Lipitor. It belongs to the statin class of medications, which are HMG-CoA reductase inhibitors used to lower cholesterol levels and reduce the risk of cardiovascular events. Understanding brand generic equivalence is crucial for pharmacy technicians to accurately fill prescriptions and assist patients, ensuring patient safety and proper medication dispensing. Question 2. Metformin is a medication commonly used to treat which of the following conditions? A. Hypertension. B. Type 2 diabetes mellitus. C. Asthma. D. Hyperlipidemia. Answer: B. Type 2 diabetes mellitus. Metformin is an oral anti-diabetic drug primarily used to manage type 2 diabetes mellitus by reducing glucose production in the liver and improving insulin sensitivity. It is often a first-line treatment due to its efficacy and relatively low risk of hypoglycemia. Pharmacy technicians must be familiar with common indications for frequently prescribed medications to ensure appropriate dispensing and to answer basic patient inquiries. Question 3. What is the primary drug class for amoxicillin? A. Macrolide antibiotic. B. Cephalosporin antibiotic. C. Penicillin antibiotic. D. Fluoroquinolone antibiotic. Answer: C. Penicillin antibiotic. Amoxicillin is a broad-spectrum antibiotic that belongs to the penicillin class of medications. It works by inhibiting bacterial cell wall synthesis and is commonly prescribed to treat various bacterial infections, such as respiratory tract infections and ear infections. Correctly identifying drug classes helps technicians understand potential drug interactions, patient allergies, and appropriate storage conditions, contributing to medication safety. Question 4. A patient picking up a prescription for warfarin Coumadin should be counseled on the importance of regular monitoring of which laboratory test? A. Liver function tests, LFTs. B. Renal function tests, RFTs. C. International Normalized Ratio, INR. D. Complete blood count, CBC. Answer: C. International Normalized Ratio, INR. Warfarin is an anticoagulant that requires careful monitoring of the International Normalized Ratio, INR, to ensure the medication's effectiveness and minimize the risk of bleeding or clotting. Regular INR testing helps prescribers adjust the dose to maintain therapeutic levels, as its therapeutic window is narrow. Pharmacy technicians should be aware of critical monitoring parameters for high-risk medications to reinforce patient education and ensure safe medication use. Question 5. Which of the following medications is a proton pump inhibitor, PPI? A. Ranitidine. B. Famotidine. C. Omeprazole. D. Cimetidine. Answer: C. Omeprazole. Omeprazole, commonly known by its brand name Prilosec, is a proton pump inhibitor, PPI, used to reduce stomach acid production. PPIs are effective in treating conditions like GERD, ulcers, and heartburn by irreversibly blocking the proton pump in gastric parietal cells. Distinguishing between PPIs and H2 blockers, like ranitidine, famotidine, and cimetidine, is important for understanding their mechanism of action and appropriate use, which aids in processing prescriptions accurately. Question 6. A prescription calls for amoxicillin 250 mg per 5 ml. Take 5 ml orally 3 times a day for 10 days. How many milliliters should be dispensed? A. 50 milliliters. B. 100 milliliters. C. 150 milliliters. D. 200 milliliters. Answer: C. 150 milliliters. To calculate the total volume, first determine the daily dose. 5 milliliters per dose multiplied by 3 doses/day equals 15 milliliters per day. Then, multiply the daily dose by the number of days. 15 milliliters per day multiplied by 10 days equals 150 milliliters. Pharmacy technicians must accurately calculate total volumes for liquid medications to ensure the correct quantity is dispensed to the patient for the full course of therapy, preventing shortages or excess medication. Question 7. A prescription reads, lisinopril 10 milligrams. Take 1 tablet by mouth daily, number 30. What is the day's supply for this prescription? A. 15 days. B. 30 days. C. 60 days. D. 90 days. Answer B. 30 days. The day's supply is calculated by dividing the total number of tablets dispensed by the number of tablets taken per day. In this case, 30 tablets divided by 1 tablet/day equals 30 days. Accurately determining the day's supply is crucial for billing, inventory management, and ensuring patients receive the correct amount of medication without needing premature refills or having excessive quantities on hand. Question 8. How many grams of a drug are in 250 milliliters of a 2% solution? A. 2 grams. B. 5 grams. C. 10 grams. D. 20 grams. Answer B. 5 grams. A 2% solution means there are 2 grams of drug per 100 milliliters of solution. To find the amount in 250 milliliters, set up a proportion, 2 grams/100 milliliters equals x grams/250 milliliters. Solving for x equals 2 * 250/100 is equal to 500/100 is equal to 5 grams. Pharmacy technicians frequently use percentage strength calculations for compounding and verifying medications, which is fundamental for accurate dosing. Question 9. Convert 5 kilograms to pounds, given 1 kilogram equals 2 lbs. A. 5 lbs. B. 5 lbs. C. 5 lbs. D. 6 lbs. Answer C. 5 lbs. To convert kilograms to pounds, multiply the number of kilograms by the conversion factor 2 lbs/kg. So, 5 kg multiplied by 2 lbs/kg equals 5 lbs. Accurate unit conversions are essential in pharmacy practice, especially for weight-based dosing and pediatric medications, to prevent medication errors and ensure patient safety. Question 10. A doctor orders AD5W4 infusion at 75 milliliters per hour. How many hours will it take to infuse a total volume of 1,500 milliliters? A. 10 hours. B. 15 hours. C. 20 hours. D. 25 hours. Answer C. 20 hours. To determine the total infusion time, divide the total volume to be infused by the infusion rate. In this scenario, 1,500 milliliters divided by 75 milliliters per hour equals 20 hours. Pharmacy technicians often prepare and verify for admixtures, making calculations like this critical for ensuring patient therapy is delivered correctly and on schedule in hospital or infusion settings. Question 11. Which federal law mandates that pharmacists offer counseling to Medicaid patients regarding their prescriptions? A. HIPAA. B. CSA. C. OBRA 90. D. PDMA. Answer C. OBRA 90. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, requires pharmacists to offer prospective drug utilization review, DUR, and patient counseling for all Medicaid patients. This law aims to improve medication outcomes and reduce healthcare costs by identifying potential drug-related problems. While primarily focused on pharmacists, technicians must understand this law as it impacts workflow and patient interaction in the pharmacy. Question 12. Under federal law, what is the maximum number of refills allowed for a Schedule III controlled substance? A. 0. B. 1. C. 3. D. 5. Answer D. 5. Schedule 3 and 4 controlled substances may be refilled up to 5 times within 6 months of the date the prescription was written. After 5 refills or 6 months, Whichever comes first, a new prescription is required. Understanding controlled substance refill limits is critical for pharmacy technicians to ensure compliance with federal regulations and prevent diversion, which is a key aspect of controlled substance management. Question 13. Which document must be completed to order Schedule 2 controlled substances? A. DEA Form 106. B. DEA Form 222. C. DEA Form 41. D. DEA Form 224. Answer B. DEA Form 222. The DEA Form 222 is a triplicate form used specifically for ordering Schedule 2 controlled substances. It provides a strict audit trail for these highly controlled medications, ensuring accountability throughout the ordering and dispensing process. Pharmacy technicians involved in inventory management of controlled substances must be familiar with proper procedures for handling DEA Form 222 to maintain compliance and security. Question 14. Protected Health Information, PHI, is governed by which federal act? A. Drug Price Competition and Patent Term Restoration Act. B. Food, Drug, and Cosmetic Act. C. Health Insurance Portability and Accountability Act. D. Combat Methamphetamine Epidemic Act. Answer C. Health Insurance Portability and Accountability Act. The Health Insurance Portability and Accountability Act, HIPAA, of 1996 protects the privacy of individually identifiable health information, known as Protected Health Information, PHI. HIPAA sets standards for the security of electronic health information and dictates how PHI can be used and disclosed, emphasizing patient rights. Pharmacy technicians must strictly adhere to HIPAA regulations to maintain patient confidentiality and avoid legal penalties for improper disclosure. Question 15. What information is not legally required on a prescription label by federal law, assuming it is dispensed to a patient? A. Patient's name. B. Name and address of the pharmacy. C. Drug manufacturer's name. D. Directions for use. Answer C. Drug manufacturer's name. Federal law mandates several pieces of information on a prescription label for dispensed medications, including the patient's name, pharmacy name and address, prescription number, date filled, drug name and strength, and directions for use. While pharmacies often include the manufacturer, it is not a federally required element on the patient's label. This knowledge helps technicians ensure label accuracy and compliance with legal dispensing requirements. Question 16. What is the primary purpose of a tall man lettering system in a pharmacy? A. To distinguish between different drug classes. B. To highlight controlled substances. C. To differentiate look-alike, sound-alike medications. D. To indicate refrigerated medications. Answer C. To differentiate look-alike, sound-alike medications. Tall man lettering is a strategy used to minimize medication errors by using mixed-case letters to highlight differences in drug names that look or sound similar, loss of medications, such as hydralazine and hydroxyzine. Implementing tall man lettering is a crucial patient safety initiative recommended by organizations like ISMP to prevent dispensing errors. Pharmacy technicians contribute to patient safety by recognizing and utilizing these visual cues. Question 17. Which of the following is an example of an auxiliary label? A. Pharmacy address. B. Patient's date of birth. C. Take with food. D. Prescription number. Answer C. Take with food. Auxiliary labels provide additional, important information or warnings to the patient about how to take or store their medication. Examples include take with food, may cause drowsiness, shake well before use, or for external use only. These labels are vital for patient education and play a significant role in safe and effective medication use, helping patients adhere to their prescribed regimen. Question 18. The term par level in pharmacy inventory management refers to A. The maximum amount of medication that can be ordered at one time. B. The average daily usage of a specific medication. C. The minimum quantity of a drug that should be on hand at all times. D. The total cost of the pharmacy's inventory. Answer C. The minimum quantity of a drug that should be on hand at all times. PAR level, or periodic automatic replacement level, is the reorder point for inventory, indicating the minimum quantity of a specific drug that should be available on the shelf before a new order is placed. Maintaining appropriate PAR levels helps prevent stockouts, ensures continuous patient care, and optimizes inventory costs by reducing waste. Pharmacy technicians are often responsible for monitoring and adjusting PAR levels. Question 19. When preparing sterile compounds in a laminar airflow workbench, LAFW, what is the correct direction of airflow for a horizontal LAFW? A. From the front of the workbench to the back. B. From the back of the workbench to the front. C. From top to bottom. D. From bottom to top. Answer B. From the back of the workbench to the front. In a horizontal laminar airflow workbench, IFW, the filtered air flows horizontally from the back of the hood, across the work surface, and out towards the operator. This continuous flow of HEPA-filtered air creates a sterile environment by sweeping away particulate matter and microorganisms. Proper understanding of airflow is essential for maintaining aseptic technique during sterile compounding, which directly impacts patient safety. Question 20. Which of the following is considered an investigational drug? A. A drug that has received final FDA approval. B. A drug available over the counter without a prescription. C. A drug undergoing clinical trials but not yet approved for marketing. D. A drug that has been recalled by the manufacturer. Answer C. A drug undergoing clinical trials but not yet approved for marketing. An investigational drug, also known as an experimental drug, is a pharmaceutical agent that is being studied in clinical trials for a specific indication, but has not yet received final approval from regulatory bodies like the FDA for commercial marketing and use. Pharmacy technicians may encounter investigational drugs in research settings and must understand the strict protocols surrounding their handling and dispensing to ensure regulatory compliance and patient safety. Question 21. What is the primary reason for performing a drug utilization review, DUR, before dispensing a prescription? A. To verify the patient's insurance coverage. B. To check for potential drug interactions or allergies. C. To confirm the drug is in stock. D. To determine the wholesale cost of the medication. Answer B. To check for potential drug interactions or allergies. A drug utilization review, DUR, is a prospective review of a patient's medication profile to identify potential drug-related problems such as drug-drug interactions, drug-allergy interactions, therapeutic duplications, or incorrect dosages. This crucial step helps ensure patient safety and optimize therapeutic outcomes before the medication is dispensed. Pharmacy technicians often assist in identifying DUR alerts for pharmacist review and intervention. Question 22. Which organization is primarily responsible for accrediting pharmacy technician training programs in the United States? A. FDA. B. DA. C. SHP. D. USP. Answer C. SHP. The American Society of Health System Pharmacists, ASHP, is the primary organization responsible for accrediting pharmacy technician training programs in the United States, often in conjunction with the Accreditation Council for Pharmacy Education, ACP. ASHP accreditation ensures that programs meet certain quality standards, preparing technicians for competent practice. While other organizations have roles in pharmacy, ASHP directly impacts technician education standards and competency. Question 23. A prescription requires 0.5 grams of a medication. If the pharmacy stocks 250 milligrams tablets, how many tablets should be dispensed per dose? A. 0.5 tablets. B. 1 tablet. C. 2 tablets. D. 4 tablets. Answer C. 2 tablets. First, convert 0.5 grams to milligrams. 0.5 g multiplied by 1000 mg/g equals 500 milligrams. Then divide the required dose, 500 mg, by the strength per tablet, 250 mg/tablet, which equals 2 tablets. Accurate unit conversion and dosage calculation are fundamental skills for pharmacy technicians to ensure patients receive the correct medication dose, preventing both underdosing and overdosing. Question 24. N4 solution contains 500 milligrams of a drug and 250 milliliters of D5W. What is the concentration of the drug in mg/ml? A. 0.5 mg/ml. B. 1 milligram per milliliter. C. 2 milligrams per milliliter. D. 2.5 mg/ml. Answer C. 2 milligrams per milliliter. To find the concentration in mg/ml, divide the total amount of drug, 500 mg, by the total volume of the solution, 250 ml. So, 500 milligrams divided by 250 milliliters equals 2 milligrams per milliliter. Calculating concentrations is a routine task in pharmacy, especially for sterile compounding, to ensure precise dosing and medication safety, which is critical in patient care. Question 25. A patient needs a topical cream with a 1,000 concentration of active ingredient. If the tube is 60 grams, how many milligrams of active ingredient are in the tube? A. 6 milligrams. B. 60 milligrams. C. 600 milligrams. D. 6,000 milligrams. Answer B. 60 milligrams. A 1,000 concentration means 1 gram of active ingredient per 1,000 grams of product. Since the tube is 60 grams, we set up a proportion. 1g/1000g equals xg/60g. Solving for x equals 60 divided by 1000 is equal to 0.06 grams. Convert grams to milligrams. 0.06 g multiplied by 1000 mg/g equals 60 milligrams. Ratio strength calculations are critical for accurate compounding and dispensing of dermatological preparations, ensuring patient safety and efficacy. Question 26. According to federal law, how long must records for controlled substances be kept readily available for inspection? A. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer B. 2 years. Federal law, specifically the Controlled Substances Act, CSA, requires that all records concerning controlled substances, g. prescriptions, inventory, DEA Form 222s, be maintained for a minimum of 2 years and be readily retrievable for inspection by the DEA. State laws may require longer retention periods, but the federal minimum is 2 years. Adhering to these record-keeping requirements is essential for regulatory compliance and preventing diversion of controlled medications. Question 27. The Combat Methamphetamine Epidemic Act of 2005, CAE, regulates the sale of which of the following ingredients? A. Pseudoephedrine. B. Ibuprofen. C. Acetaminophen. D. Diphenhydramine. Answer A. Pseudoephedrine. The Combat Methamphetamine Epidemic Act of 2005, CAE, regulates the retail sale of drug products containing pseudoephedrine, ephedrine, and phenylpropanolamine due to their use in illicit methamphetamine production. This act sets limits on the quantity that can be purchased, requires photo identification, and mandates record-keeping of sales. Pharmacy technicians must be aware of and comply with CMEA regulations to prevent misuse and diversion of these products. Question 28. Which of the following activities is generally not permitted for a certified pharmacy technician, even under direct supervision of a pharmacist? A. Receiving a new prescription over the phone from a prescriber. B. Entering prescription information into the computer system. C. Preparing a sterile 4 admixture. D. Counseling a patient on new medication side effects. Answer D. Counseling a patient on new medication side effects. Patient counseling regarding new medication side effects, drug interactions, and proper use is legally considered a pharmacist's responsibility under most state and federal regulations, e.g., OBRA 90, because it requires professional judgment and clinical assessment. While technicians can assist in identifying counseling points, the actual act of counseling must be performed by a pharmacist. Understanding this distinction is crucial for maintaining legal and ethical boundaries in practice. Question 29. Which of the following is a very common side effect of opioid pain relievers? A. Diarrhea. B. Constipation. C. Hypertension. D. Insomnia. Answer B. Constipation. Constipation is a very common and often problematic side effect of opioid pain relievers due to their action on opioid receptors in the gastrointestinal tract, which slows down bowel motility. Patients taking opioids should often be counseled on preventative measures, such as increased fiber intake or use of laxatives. Recognizing common drug side effects is essential for pharmacy technicians to answer patient questions and provide appropriate warnings or refer to the pharmacist. Question 30. A patient presents with a prescription for azithromycin 250 mg number 6. Take 2 tablets on day 1, then 1 tablet daily for 4 days. What is the correct days supply? A. 4 days. B. 5 days. C. 6 days. D. 7 days. Answer B. 5 days. To calculate the day's supply, break down the dosing schedule. On day 1, the patient takes 2 tablets. For the subsequent 4 days, they take 1 tablet each day, totaling 4 tablets. The total number of tablets consumed is 2, day 1, plus 4, days 2 to 5, equals 6 tablets. Since all 6 tablets are consumed over this 5-day period, the day's supply is 5 days. Calculating days supply for unconventional dosing regimens requires careful attention to detail for accurate dispensing. Question 31. Tamsulosin Flomax is primarily used to treat symptoms associated with A. Benign prostatic hyperplasia, BPH. B. Erectile dysfunction. C. Overactive bladder. D. Kidney stones. Answer A. Benign prostatic hyperplasia, BPH. Tamsulosin Flomax is an alpha-1 blocker specifically used to relax the muscles in the prostate and bladder neck, thereby improving urine flow and reducing symptoms of benign prostatic hyperplasia, BPH, in men. It does not treat the enlarged prostate itself, but alleviates the urinary symptoms. Technicians should recognize the common indications for frequently prescribed medications, which aids in verifying prescriptions and addressing basic patient questions. Question 32. Which auxiliary label should always be considered for a prescription of warfarin Coumadin due to its high-risk nature? A. May cause drowsiness. B. Shake well before use. C. Take with food. D. May cause bleeding. Answer D. May cause bleeding. Warfarin is an anticoagulant, blood thinner, that carries a significant risk of bleeding as a major adverse effect. Therefore, an auxiliary label warning the patient about the potential for bleeding and encouraging them to report unusual bruising or bleeding is crucial for patient safety. This highlights the importance of recognizing high-alert medications and their specific counseling points to reinforce patient understanding of critical risks. Question 33. The term NDC National Drug Code identifies which of the following? A. The manufacturer, drug, and package size. B. The patient, prescriber, and pharmacy. C. The drug's therapeutic class. D. The drug's expiration date. Answer A. The manufacturer, drug, and package size. The National Drug Code, NDC, is a unique 10 or 11-digit 3-segment number that serves as a universal product identifier for human drugs. The first segment identifies the manufacturer or labeler, the second identifies the specific drug product, strength, dosage form, formulation, and the third identifies the package size. Pharmacy technicians use NDC numbers for inventory management, billing, and ensuring product accuracy during the dispensing process. Question 34. Beyond use date, BUD, for compounded non-sterile preparations is determined by A. The manufacturer's expiration date. B. Federal law only. C. USP guidelines and stability data. D. The pharmacist's discretion. Answer C. USP guidelines and stability data. Beyond use dates, buds, 4 compounded non-sterile preparations are assigned by the compounding pharmacist based on USP less than 795 guidelines, which consider factors like the preparation's water content, dosage form, and available stability data. Unlike manufacturer expiration dates, which apply to commercial products, buds specifically address the stability of compounded products once they are prepared. Adhering to buds ensures the potency and safety of compounded medications for patients. Question 35. What is the primary purpose of a formulary in a hospital or managed care setting? A. To list all available medications in the world. B. To identify medications that are currently out of stock. C. To provide a list of approved medications covered by the plan/hospital. D. To track controlled substance usage. Answer C. To provide a list of approved medications covered by the plan/hospital. A formulary is a continually updated list of medications approved for use within a healthcare system or covered by a health insurance plan. Its primary purpose is to promote safe, effective, and cost-effective medication therapy by guiding prescribers and patients toward preferred drugs. Pharmacy technicians frequently work with formularies for ordering, dispensing, and managing prior authorizations, which streamlines medication access and cost control.